Your prostate is a small, walnut-sized gland that sits just below your bladder. It's a key player in men's reproductive health, producing fluid that supports sperm. But here's the thing. This tiny gland can cause big problems if you don't keep an eye on it. Prostate cancer is the second most common cancer among men in the US, and 1 in 8 will face it in their lifetime. That's a big deal. The good news? Catching it early can make all the difference. Think a near 100% 5-year survival rate if it's found before it spreads. But here's the catch. Prostate cancer can be sneaky. It often starts with no symptoms or ones so subtle you might brush them off as just getting older. That's why knowing what to look for is so important. Today, we're going to walk through 7 warning signs you should never ignore, plus some natural ways to keep your prostate in top shape. Ready? Let's get started. Before we jump into the signs, let's talk about why catching prostate cancer early is a lifesaver. When it's still localized, meaning it hasn't spread beyond the prostate, treatment is often highly effective. But if it advances, things get trickier and survival rates drop. That's why paying attention to your body and getting regular checkups is non-negotiable, especially if you're over 50 or have risk factors like a family history of prostate cancer or African American heritage, which can increase your odds of developing it. Early detection starts with you. Routine screenings like the PSA test, that's prostate-specific antigen, and a quick digital rectal exam can spot issues before you even notice symptoms. These tests are simple, fast, and could literally save your life. Pair that with a healthy lifestyle and you're giving your body the best shot at staying strong. But first, you need to know what your body's trying to tell you. Let's break down those 7 warning signs. 7 warning signs of prostate cancer. Sign #1. Needing to pee all the time, especially at night. Ever find yourself waking up multiple times a night to hit the bathroom? That's called nocturia, and it's one of the earliest red flags for prostate issues. When the prostate enlarges, whether from cancer or something benign like an overgrowth, it presses on your bladder, making it feel full even when it's not. If you're sprinting to the bathroom more often than usual or losing sleep over it, don't just chalk it up to aging. It's time to check in with your doctor. Sign #2. Trouble starting or stopping your flow. Picture this. You're standing at the toilet, ready to go, but it takes forever to get started. Or maybe you can't fully stop the flow, and it dribbles. This hesitation or inconsistency happens when an enlarged prostate squeezes the urethra, the tube that carries urine out of your body. It's not just annoying, it could point to something serious. Keep track of how often this happens and talk to your healthcare provider. Sign #3. Weak or stop-and-go urine stream. If your urine stream feels more like a trickle than a steady flow, or it starts and stops like a faulty faucet, that's another sign to watch for. An enlarged prostate can block the urethra, making it harder for urine to pass through smoothly. This can also lead to incomplete bladder emptying, which might set you up for infections. If your stream's not what it used to be, don't ignore it. Sign #4. Blood in your urine or semen. Seeing blood in your urine or semen is never normal, and it's a sign you should act on immediately. Known as hematuria or hematospermia, this can happen if the prostate or nearby tissues are irritated or damaged. While it might be caused by something less serious, like an infection, it's also a potential hallmark of prostate cancer. Get to a doctor ASAP to figure out what's going on. Sign #5. Pain or burning. When you pee, does it sting or burn when you urinate? That discomfort, called dysuria, could signal inflammation, an infection, or something more concerning like prostate cancer. If this pain comes with other symptoms like frequent urination or blood in your urine, it's even more urgent to get checked out. Don't brush it off as a minor annoyance. Your body's trying to tell you something. Sign #6. Persistent pain in your back, hips, or pelvis. Prostate cancer can spread to nearby bones, causing deep, nagging pain in your lower back, hips, or pelvis. This isn't the kind of ache you get from a tough workout. It's persistent and doesn't go away with rest. If you're dealing with unexplained pain in these areas, especially alongside other symptoms, it's time to talk to a professional. Sign #7. Unexplained weight loss or fatigue. Feeling wiped out all the time or noticing the scale dropping without trying, these could be signs that prostate cancer has progressed. Advanced cancer can mess with your metabolism, leading to weight loss and constant tiredness. These symptoms are serious because they often mean the disease has moved beyond the prostate. Catching it earlier can help you avoid getting to this point. A quick reality check. Now, before you start panicking, here's the deal. Having one or more of these symptoms doesn't automatically mean you have prostate cancer. Things like infections, an enlarged prostate from non-cancerous causes, or even lifestyle factors can mimic these signs. But here's the kicker. You won't know unless you get checked. Ignoring these signals is like ignoring a check engine light in your car. It might be nothing, but it could also be a big deal. So let's talk about what to do next. What to do if you notice these signs. If any of these symptoms sound familiar, don't wait. Pick up the phone and book an appointment with your doctor. Be honest about what you're experiencing, even if it feels a little embarrassing. Your doctor's heard it all before, trust me. They might recommend tests like a PSA blood test to check for elevated levels or a digital rectal exam to feel for any abnormalities in the prostate. If needed, they might order imaging like an MRI or a biopsy to get a clearer picture. While you're waiting for your appointment, start keeping a symptom journal. Jot down when these issues happen, how often, and how severe they are. This can help your doctor spot patterns and make a more accurate diagnosis. And don't go through this alone. Talk to a trusted friend or family member, or even join a men's health support group. Having support makes all the difference. Natural ways to support prostate health. While medical checkups are crucial, you can also take charge of your prostate health with some natural, holistic strategies. Here are 4 science-backed tips to lower your risk and keep your prostate in check. Tip #1. Load up on prostate-friendly foods. Your diet is a powerful tool. Focus on foods rich in antioxidants like tomatoes, which contain lycopene, a compound linked to lower prostate cancer risk. Berries, leafy greens, and cruciferous veggies like broccoli are also superstars for fighting inflammation. Swap processed foods for whole grains, and consider adding nuts like walnuts, which are packed with healthy fats that support overall wellness. Tip #2. Stay active. Regular exercise isn't just good for your heart, it's great for your prostate too. Aim for at least 30 minutes of movement most days, whether it's brisk walking, swimming, or yoga. Exercise helps maintain a healthy weight, boosts your immune system, and may even lower your cancer risk. Plus, it's a natural stress buster, which is a win for your whole body. Tip #3. Cut back on alcohol and tobacco. If you smoke or drink heavily, now's the time to scale back. Both tobacco and excessive alcohol are linked to higher cancer risks, including prostate cancer. Try swapping that extra beer for a glass of antioxidant-rich green tea or sparkling water with a splash of lemon. Your prostate will thank you. Tip #4. Prioritize stress management. Chronic stress can weaken your immune system and throw your hormones out of whack, which isn't great for prostate health. Try simple stress relievers like deep breathing, meditation, or spending time in nature. Even 10 minutes a day can make a big difference in keeping your body balanced. Bonus tip: the power of pumpkin seeds. Here's that bonus tip I promised. Did you know pumpkin seeds are a prostate health powerhouse? They're loaded with zinc, a mineral that's essential for keeping your prostate functioning properly. Studies suggest zinc may even help reduce the risk of prostate issues. Toss a handful of raw, unsalted pumpkin seeds into your smoothies, salads, or just snack on them. It's an easy, natural way to give your prostate some extra love. Your next steps. All right, let's wrap this up. Prostate cancer is a serious concern, but you have the power to stay ahead of it. By knowing these 7 warning signs, frequent urination, trouble with flow, weak stream, blood in urine or semen, painful urination, persistent pain, and unexplained weight loss or fatigue, you're already one step closer to protecting your health. Combine that with regular checkups, a healthy diet, exercise, and stress management, and you're building a solid defense. If you're over 50, or if you have a family history or other risk factors, don't wait. Schedule a screening with your doctor today. And if you know someone who needs to hear this, share this video with them. It could be the nudge that saves a life. Your health is worth it, and so is theirs. Let's keep the conversation going. Thanks for joining me today on this journey to better health. If this video helped you, hit that like button and subscribe for more natural health tips to live your best life. Drop a comment below. Let me know if you've got questions or want us to cover another wellness topic next. Together, we're building a community that's all about thriving naturally. Until